Welcome to your guide to planning for government retirement, brought to you by the Blue Cross and Blue Shield Service Benefit Plan. We want you to know that wherever you are on your service journey, it's never too early to start planning for retirement. Today we'll help you understand how to create a plan that works for you and your family and talk about different coverage options available to you in retirement. Let's start by thinking about how to make the most out of your retirement. The earlier you start thinking about how you want to prepare for retirement and spend that time, the better off you'll be. On behalf of the Blue Cross and Blue Shield Service Benefit Plan, we want to thank you for your years of federal service. Think about the things you enjoy doing in your free time, whether that be travel, spending time with family, or something else altogether. Knowing how you want to spend your retirement can help you better plan for the future today. No matter your age, taking care of yourself now can help you enjoy your life after retirement more. Staying up to date on your doctor's visits and screenings and maintaining a healthy lifestyle can help you live a longer, healthier life. Which means more time for the hobbies and activities you enjoy most. Next, we'll talk about what goes into planning for retirement. Remember, it's never too early to start planning. That said, we recommend you start thinking about your retirement at least 5 years before you decide to retire. In order to keep your health benefits coverage in retirement, you'll need to have 5 years of continuous coverage in the Federal Employees Health Benefits Program, or FEHB. This only applies to medical coverage, not dental and vision coverage offered through the Federal Employees Dental and Vision Insurance Program, or FEDVIP. Next, talking to friends about their retirement experiences can be helpful, but remember that everyone's retirement needs and plans are different. It's important to know your individual options. That doesn't mean you should plan for retirement in a silo. If you are married or in a committed relationship, discuss your plans with your significant other. Financial and health needs are other important parts of planning. Make sure to take inventory of financial assets you have and what you might need. You don't have to go it alone, a financial planner can help. And think about your health needs now as well as possible future needs. Keep your family's needs in mind too. Here are some thought starters that can help you evaluate the health needs for you and your family. How important is it to have a large network of providers? Know that you're covered if you go out of town or travel overseas? Have prescription drug coverage? Be protected if you have a catastrophic medical event? It's also important to ask yourself how much you're willing to pay for coverage. Next, we'll talk about the different benefit options that are available to you in retirement. As a federal government employee, you have a lot of options. You can take many of your benefits into retirement with you, like your FEHB and FEDVIP coverage. However, keep in mind that if you are currently enrolled in a flexible spending account, you will not be able to take that into retirement with you. When it comes to deciding whether or not to keep your medical coverage, you can ask yourself a few questions to help make the decision. Should I keep my government insurance when I retire, or should I look at different plans? What changes with my health insurance when I retire? What is Medicare and how does it fit into my plans? Remember, as a federal employee you get some of the best medical coverage in the U.S. If you're thinking about keeping your FEHB coverage when you retire, you're in luck. Your benefits remain the same in retirement and your premiums aren't higher than actively working employees. As long as you don't cancel your FEHB, you'll remain covered throughout your entire retirement. If you cancel your coverage, you will never be able to re-enroll in the FEHB. So, if you're considering a non-FEHB plan, suspend your coverage rather than canceling it. For more information on suspending your FEHB enrollment, contact your retirement office. There's time to review your options every year. Open season, which is typically the second Monday in November through the second Monday in December, and qualifying life events give you the opportunity to review and reassess your needs. Before we move on, here are some additional things to consider. Keep the 5-year rule we talked about earlier in mind. The federal government will continue to pay a portion of your premium, about 70%. You'll pay your premium monthly. Your payroll office becomes the U.S. Office of Personnel Management, or OPM. If you pass away, your eligible surviving family members can keep your coverage. You must be enrolled in a Self+1 or Self and Family plan when you pass away for this to apply. Now let's dive into Medicare. It can seem complicated, but we'll break it down so it's easy to understand your options. Medicare is a health insurance program provided by the U.S. government to individuals 65 and older, those with certain disabilities or those with end-stage renal disease. If you sign up for Medicare and are still actively working, your FEHB plan is usually your primary coverage, meaning it pays first. If you're retired, Medicare is usually your primary coverage. There are 4 different parts of Medicare: A, B, C, and D. Part A is hospital insurance. It covers inpatient, skilled nursing facility, home health and hospice care. Most people don't pay a premium for Part A. Part B is medical insurance. It covers doctor's visits, outpatient services, x-rays and lab tests, durable medical equipment, preventive services, physical and occupational therapy and other services not covered by Part A. You pay a premium for Part B. We'll cover this more on the next slide. Part C is a Medicare Advantage plan. This is private health insurance that helps to cover some of the things that Part A and Part B don't cover. Premiums for Part C plans vary by provider. Part D is prescription drug coverage, which is not included in Medicare Part A or Part B. Here's more info on Medicare Part B premiums. Medicare Part B has a standard premium amount that most people pay. However, if your modified adjusted gross income as reported on your IRS tax return from 2 years ago is above a certain amount, you'll pay the standard premium amount and an income-related monthly adjustment amount, or IRMA. An IRMA is an extra charge added to your premium. Here's a chart that includes the premium with the current added IRMA amounts depending on your income from 2 years ago. You don't have to worry about enrolling in Medicare until you become eligible for it. This usually happens 3 months before your 65th birthday and ends 3 months after your 65th birthday. Social Security also plays a part in your Medicare enrollment. If you receive Social Security benefits at least 4 months before turning 65, you'll automatically be enrolled in Medicare Part A and Part B. Your coverage will start the first day of the month of your 65th birthday. If your birthday is on the first of the month, your coverage will start the month prior to your birthday. If you are receiving Social Security benefits, you can opt out of receiving Part B coverage if you want. In order to opt out, you'll need to follow the directions you're given with your Medicare member ID card. You'll receive your card 3 months before you turn 65. If you're not automatically enrolled and don't receive a Medicare member ID card, you can contact your local Social Security office. Learn more at ssa.gov. Remember, you get to choose your retirement options. Enrolling in Medicare is a choice, you are not required to sign up. Before you make a decision, you should consider your future health needs. Even if you're in perfect health now, health needs tend to change as we age. If you missed your eligibility window to sign up for Medicare, it's not too late. However, there may be penalties. You pay a late enrollment penalty if you don't enroll in Medicare Part B when you're first eligible. The penalty is a 10% premium increase for each year you delay enrollment. You also usually have to wait for the annual Medicare General Enrollment Period, January to March, to sign up if you choose to enroll later. The penalty doesn't apply if you or your spouse is still actively working during your initial enrollment period and you choose to keep your employer-sponsored health coverage. In this case, once you retire, you'll have 8 months to enroll in Medicare without penalty. You can also sign up at any time while you're still working. You may have heard of Medicare supplement plans or Medigap coverage. These plans are different from Medicare Advantage, and your FEHB plan is not Medigap. Medicare supplement plans are independent plans that supplement your original Medicare coverage. They can help cover things Medicare doesn't cover. Your FEHB plan also covers many things that Medicare doesn't cover and can help supplement your original Medicare coverage. You typically don't need an additional supplement plan if you keep your FEHB coverage. So, now let's talk about combining Medicare coverage with your FEHB coverage. Both FEHB and Original Medicare provide great benefits. Choosing to combine them can offer you even greater benefits. Let's get into the details. There are gaps in the things that Medicare Part A and Part B cover. Some of the gaps include prescriptions, hearing aids, dental care, and overseas care. Your FEHB plan may cover these services. Combining coverage may also reduce costs. Many FEHB plans waive or reduce deductibles and co-pays when Medicare is your primary coverage. For example, with Medicare Part A you pay a deductible for inpatient hospital care. If you combine your coverage, your FEHB plan may pay that deductible for you. You'll also want to think about your prescriptions. Medicare Part A and Part B don't cover prescription drugs. If you don't keep your FEHB coverage, you'll need to enroll in a plan that covers prescriptions, such as a Medicare Part D plan, which will have an additional premium. However, if you keep your FEHB coverage, you will not need to enroll in a supplemental prescription plan. OPM has said that FEHB plan's prescription drug coverage covers the same amount that a Medicare Part D plan would cover, on average. Let's talk about premiums. As we noted earlier, Medicare Part A is free for most people. Because of that, most federal employees/retirees take it as soon as they're eligible. However, you do pay a premium for Medicare Part B. If you combine your coverage, you'll pay the Medicare Part B premium and your FEHB plan's premium. If you calculate the cost of both premiums, the overall annual cost of both can be lower than your medical costs, especially as your health needs grow later in life. Additionally, some FEHB plans have benefits or programs that can help members pay their Part B premiums. Also, keep in mind that the federal government continues to pay a large portion of your FEHB premium, roughly 70%, even once you retire. Don't worry, we didn't forget about FEDVIP. Medicare Part A and Part B don't cover vision and dental care, but your FEHB plan may offer some coverage. If you need additional coverage beyond what your FEHB plan offers, enrolling in a FEDVIP dental or vision plan could be good for you. Similar to FEHB, FEDVIP dental and vision benefits don't change once you retire. You'll pay your premium monthly. Now let's talk about Medicare Part C or Medicare Advantage. These plans are offered by companies that contract with Medicare. These plans are bundles that include services that Part A, Part B and sometimes Part D cover. They may also include some additional services. You have different options for Part C plans, such as Preferred Provider Organizations, PPOs, and Health Maintenance Organizations, HMOs. You're typically limited to a specific local network with these plans. Make sure you understand the benefits and restrictions if you're considering one of these plans. The premium you'll pay depends on the plan. Because you need to be enrolled in Original Medicare to have these plans, you'll still pay the Medicare Part B premium plus your Medicare Part C premium. The plans offered to you can vary based on where you live. If you're deciding between FEHB and Medicare Advantage, you should look at the costs and benefits of each to see which is right for you. And remember, if you cancel your FEHB coverage in retirement, you can never re-enroll in the program. If you want to try a different plan that's outside of the FEHB, suspend your coverage, don't cancel it. We've covered a lot of information today. Let's wrap it up with some final thoughts about combining your FEHB plan with Medicare. The best way to decide whether to combine or not to combine is to determine what your needs are and what you think they may be in the future. Make a decision about your coverage based on those needs. You want to make sure your choice gives you peace of mind. And if you want to know how your current FEHB plan combines with Medicare, you can reach out to them. If you have questions about anything we've covered here, you can call or go online for answers. If you're a Blue Cross and Blue Shield Service Benefit Plan member, you can visit fepblue.org/Medicare or call the customer service number on the back of your member ID card. If you have a different FEHB plan, You can go to their website or call customer service. For additional information, here are other helpful resources you can utilize as you plan for retirement. You can easily stay connected with the latest service benefit plan news and updates by following us at FEP Blue and signing up for our Blue News newsletter. Thank you for attending this presentation today. We wish you well as you continue to plan for retirement. And remember, we're here to help in any way we can.